to today's Pet Podcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. So today we have an exciting topic for you. We can never discuss this topic enough because it's so important for all of the animals that live really in any state in the United States, but particularly in the South, and that is heartworm disease. Heartworm disease is a disease that affects dogs and cats, and we're going to give you as much information as we can to help you keep your pets safe. In the meantime, I do want to introduce you of the pet of the week this week. Our pet of the week is Preciosa. Preciosa is a sweet, sweet girl. She is a lab mix. She's about a year old. And, Preciosa came to us through our Animal Cruelty Investigations Department because she was abandoned. And part of her health conditions that our veterinary team discovered was that Preciosa also had heartworm disease. Now, Preciosa is doing really well right now. She is recovering from her heartworm disease. She's been treated, and we're going to talk all about that. So she is in great health. She's ready to find her new family and her home. So we encourage you to come on down to our adoption center between 11 a.m. and 6 p.m. daily and meet Preciosa and all of our other dogs and cats available for adoption. We'd love to have you. So let's get started talking about heartworm disease. And there's so much that we can go over. So I'll start by taking questions from you guys.
All right, so what are heartworms and how do the dogs get them?
Great place to start. So a heartworm is a type of internal parasite. It's an internal parasite. The unique thing about heartworms is that heartworms live inside the bloodstream. And so this is not like other worms that you might hear about in dogs and cats that live in the gastrointestinal tract, like the stomach and intestines. Heartworms live in the bloodstream, and they love to live in the heart, which is why they get their name. Now, how do they contract heartworm disease? They get heartworm disease from a mosquito, which is why it's so important for those of us who live in the South, particularly, the South, West and Central South, because there's such high heartworm, such high mosquito population and heartworm incidence. So we're going to talk to you today a little bit about that and how we're going to prevent it and treat it. So, number one, I do want to talk about how that disease is transmitted by the mosquito. So imagine that we have a dog that has heartworm disease. In that dog's bloodstream, there are what we call very small baby heartworms that we call microfilaria. Microfilaria are tiny immature heartworms that live in the bloodstream. If your dog is outside on a walk, maybe just enjoying the sunlight, sunbathing, or maybe your dog spends most of his or her time outdoors, they're exposed to mosquitoes. So a mosquito may land on a heartworm positive dog, and mosquitoes take a blood meal. The way that mosquitoes get their nutrition is through a blood meal. So the mosquito will bite the heartworm positive dog. In that process, as they are gathering that blood meal from the dog, they ingest some of those tiny microfilaria. What happens after that is those microfilaria develop inside the mosquito's body. Those tiny little microfilaria, they grow inside of the mosquito. And it takes several months for them to grow inside the mosquito before they can be infective to another dog. So that same mosquito will now bite dog number 2, who does not have heartworms, and dog number 2 now gets bitten by the mosquito, and those infective heartworms now have been transmitted to dog number 2, and dog number 2 now has heartworm disease. This is how heartworm disease is spread. And because there are so many mosquitoes in our environment, it can spread pretty rapidly, and we find that lots of dogs that come to us are heartworm positive.
So they're not necessarily contagious, like from sharing a bowl or even from just being around other dogs who are heartworm positive.
No, you're exactly right. That these are not contagious directly from dog to dog, which is different than intestinal parasites, where your dog can get intestinal parasites from dog just by coming in contact with the stool, with the feces. Heartworms only transmitted by mosquitoes. Great question.
So how do we know if a pet has been bitten by one of these mosquitoes and now has heartworms?
So we don't know just by looking at the dog, and that's one of the interesting things about this disease is we want to be able to catch it early. But the way that we're going to be able to catch it early is by the dog going into the veterinary hospital or the veterinary clinic and getting a blood test. There are very quick blood tests that take 10 minutes or less to determine whether or not the dog has heartworm disease. Now, what we need to mention here is that, dog number 2, when I mentioned dog number 2 getting bitten by the mosquito and getting heartworm disease, we won't know whether or not dog number 2 has been infected for about 6 to 7 months. It can take 6 to 7 months for those immature heartworms to mature in the dog to a stage that we can test for. When we test for heartworm disease, we are testing for adults. We're testing for adults that are living in the dog's bloodstream. And so if it's in the early stages, between 0 to about 6 or 7 months, we may not be able to test accurately for heartworm disease. And so once a dog reaches the age of 6 months, typically we'll start testing them every year, and we're testing them for adult heartworms in the bloodstream.
So what does heartworms lead to, or what does it cause the dog?
The most severe thing is that, when we're talking about heartworms living in the bloodstream, what they do is they migrate through the body, and they typically like to live in the heart. And there's even a specific location in the heart that they like to live. As they grow in the body, they go through several stages. And so they'll be immature in the bloodstream, and then they go through a stage where they're in the muscle of the body, where they're maturing and growing, and then they re-enter the bloodstream as adults, and they live in the heart, mainly in the pulmonary artery. The pulmonary artery, you can see these hearts here, as a matter of fact. This is a picture of an actual heart. This is a specimen of an actual heart. And if you can see these spaghetti-like strings here, those are actual heartworms that are inside the heart. And they like to live in the pulmonary artery. So that's the artery that is carrying blood away from the heart and going to the lungs. And so this is an example of what the heartworms look like in the heart. So when they live in the heart, they can obstruct blood flow. So in this particular example, there's only maybe 2 or 3 heartworms here. But in many cases, dogs may have 15, 20, or 50 heartworms in their heart. And you can imagine that with all those worms, it's almost like a bundle of spaghetti, of cooked spaghetti, and it's plugging up the heart, which obstructs blood flow. And if it obstructs blood flow, eventually the heart will go into heart failure. And so it's a very, very serious condition that we want to make sure gets treated, because we do not want dogs who have heartworm disease to go into heart failure because we've allowed this to go on for years at a time. So early signs, though, can lead to coughing, exercise intolerance, where your dog may just seem really tired and cough a lot, lethargy, and in worst cases, you might see difficulty breathing, and you may see signs of heart failure where the belly gets big from fluid, because since the heart cannot pump blood effectively, the fluid portion of the blood begins to leak out into other areas of the body, and sometimes they get a very distended abdomen. That's very end stage, and a certainly more emergent case with a poor prognosis.
So then how long can a dog live with heartworms if they're not treated?
Dogs can live with heartworms for many years before it turns into heart failure. But once they're in heart failure, it can be very, very difficult to treat them and to have them to survive the treatment. But initially, when they first contract heartworms, it's very difficult to know that they have it. Many dogs are asymptomatic. They don't show any signs of coughing or exercise intolerance. It's only until that worm burden, we call it a worm burden, gets high enough that it begins to affect the size of the heart and the pumping of the blood. And then we start to see the coughing and the exercise intolerance. So it's important that you take your dog to the veterinarian every year to test for heartworms, because we want to be able to pick it up and test for it before your dog becomes symptomatic.
All right, so how is it treated?
So once we diagnose your dog with heartworm disease, we are then going to schedule your dog for treatment. Now, there's a couple of different ways that you might find your veterinarian wants to treat heartworm disease in your pet. But it's important that I let you know that officially, there's only one way to kill the heartworms in your dog's body, to get to the straightforward way to kill the heartworms. And that's with a drug that we call melarsoline. Melarsoline is an injection that's given in a series of injections to your dog with heartworm disease over a period of time. Your veterinarian will go through the details of this because typically it happens in stages. We first will prescribe an antibiotic. That antibiotic actually helps to kill a particular type of bacteria in your dog's blood that lives in a symbiotic relationship with the heartworms. So if we kill this bacteria, we can weaken the heartworms. So we'll start with an antibiotic. After that, then we'll begin a series of melarsoline injections. Your veterinarian will determine the frequency with which your dog gets those injections and when you need to come back for rechecks. But it does require injections. It does require a series of injections along with those antibiotics. And oftentimes it requires pain medicine and anti-inflammatories to help deal with the after effects of the heartworm treatment. Because as the worms begin to die, they can release toxic substances into the blood, and some dogs will have allergic reactions to that. And so it's important to follow all your veterinarian's instructions regarding heartworm treatment.
And so for that type of treatment, what, how is the at-home care, consist of, or is it stressful for the dog or painful?
Yes, so the injections of melarsoline are actually given in the muscle. They're given in what we call the epaxial muscles, which are muscles on the back, on your dog's back, just on either side of their spine. So these injections are given in the muscle. And just like you can imagine, whenever you get an injection in the muscle, that area can become sore. Sometimes it can become swollen. And sometimes patients who get this injection will become lethargic, and in some cases have more serious side effects like vomiting or diarrhea or inappetence. But most of the time, dogs do really, really well on the treatment. They do really well. We don't see side effects super often. And so with proper monitoring and care, we can typically make sure that we mitigate these side effects. Now, after treatment, your veterinarian is going to recommend that your pet stay very calm after the treatment for several weeks. And this is because, again, as the heartworms die, they can release a toxic substance into the body, and that can lead to additional side effects. And so keeping them quiet can actually help to mitigate those side effects. So just allowing them to be a couch potato, giving them lots of tender love and care in the post-injection period is going to be what we recommend for your pet.
And we've heard of, slow kill treatment versus fast kill. Is there a true difference, or how would a vet determine which option is best for my pet?
These are interesting terms that you might hear out in the community. This idea of slowly killing the heartworms versus fast kill or killing heartworms fast. And really what we like to decide is that, are we going to do, we follow protocols by the American Heartworm Society, and the American Heartworm Society recommends the only approved drug to kill heartworms, which is melarsoline. Now, melarsoline can, in some cases, be expensive and cost prohibitive for some pets, particularly if they're very large, because it uses a lot of drug. And so in other options where maybe the pet is older, or we, for whatever reason, are not able to give melarsoline, there are other ways that you can help your dog's own body rid itself of the heartworms. It does still require the administration of medication, and it takes longer. The concern with it taking longer with this slow kill is that as long as the heartworms are inside the heart, they're doing damage. As long as they're there, they're doing damage. And so we want to be able to rid your pet of these heartworms as soon as possible, and do that safely. And we have protocols to be able to do that safely. The slow kill method is a way that over a period of time, your dog's body and its immune system can rid itself of the heartworms, but it usually takes several years to have that happen, and it still requires the administration of medication, either orally or topically, to help that process.
All right, so how do we prevent these worms from ever entering the body?
Yes, we want to prevent it. Prevention is the best way to handle heartworm disease, and that is by there's a number of products out there. Heartworm disease can be prevented by administering an oral product once a month, a topical product once a month, or there's even an injectable product that can be given every 6 months. So there are several options out there, and even there's several oral options, there's several topical options. And so the best thing to do is for you to speak with your family veterinarian about what is best for you. If you think you're the kind of person that may not remember on a monthly basis to give that oral tablet or to put that topical liquid between the shoulder blades, maybe an injection that you only have to go in for twice a year would be maybe an option for you, a better option for you. But if you're the kind of person you can put it on your calendar or set yourself an alarm and once a month you can give your dog this heartworm prevention, that's like a treat, then certainly you can do that. Typically, the once a month orals tend to be a little less expensive, and it also depends what else the medications can treat. A lot of heartworm prevention drugs will not only prevent heartworm disease in your dogs, but they will also prevent intestinal parasites and fleas and sometimes ticks. So they can be very good products all in one that can help protect your dog in a number of ways.
And I know like fleas and tick prevention we can buy like at any pet store. Can that be the same for heartworm prevention?
So generally you need a prescription from your veterinarian to get heartworm prevention. And that's because the risk of giving your pet this drug, if they are heartworm positive, can be high. So we want to know if your dog is heartworm positive before we prescribe this particular medication. So always see your family veterinarian, get a test for heartworm disease before you get the prescription, because we want to make sure that we're not going to give your dog something that could be harmful if he or she is already positive for the disease.
And that's another question, you know, if my pet is on that monthly heartworm prevention on the dot, why do they still need a heartworm test?
You know, it's because not all medication is 100% effective. We want to make sure that the medication is doing its job, and we cannot guarantee that without testing and making sure that it's effective. So it's still recommended and standard protocol to test your dog for heartworm disease once a month. In addition, if you're anything like me, sometimes you are forgetful and you might forget that heartworm prevention. Even 1 month you might forget, or you might give it late. And so during that period of time where your dog may be susceptible, if they have gotten bitten by a mosquito that has heartworms, then we want to make sure that we test every year to capture even that 1 month of skipped medication.
Yeah, and if we skip it, you know, accidentally, do we just give double doses or do we just go back on schedule for the next month?
Yes, if you can, give it as soon as you realize that you need to give it, and make that your new start date for the month. So
Okay.
if you can give it as soon as possible, now you can give it 30 days after that.
All right, a big myth is, you know, my dog is indoors and indoor only dog, so he doesn't need any prevention.
Yes, well, how many times, especially those of us in the South, have you been inside all day and you're still scratching yourself because you have mosquito bites? Mosquitoes will find a way to get that blood meal. And so they may come in through a window, through a screen door, the quick little time that you're walking from your home to your car, or you're letting your dog out to go to the bathroom, they are getting exposed to those mosquitoes. And so even if your dog spends 90% of his or her time indoors, they still are exposed to mosquitoes and they can still contract the disease.
And even, you know, in the cooler months, you know, it's amazing weather now, so I don't see them out anymore, but do they still need them even during those cold months?
Yes, even during the cold months, mosquito populations are down, but they are not zero. And so we would rather you be safe than sorry. And it's recommended to give that heartworm prevention 12 months year round.
And then for prevention, a lot of, you know, people are going to say prevention can be costly. You know, any tips for that?
Absolutely. So even though prevention can cost, it is so much cheaper than the treatment. So, you know, monthly prevention can be as cheap as $8 or $9 a month. In some cases, if you have a small dog, it may be as inexpensive as $3 or $4 a month. So monthly prevention can be actually quite inexpensive. Now, when you compare that to the treatment, if your dog actually has heartworm disease, we can be talking hundreds or thousands of dollars to treat your dog. And so we want to make sure that we save you that cost of treating the dog, save the dog, the trouble of going through the treatment, and that we prevent this disease from happening.
And do heartworms only affect dogs, or can cats also get them too?
Cats can get heartworm disease as well. And so when cats get heartworm disease, it actually takes fewer heartworms in cats to cause really severe symptoms. So mosquitoes can transmit heartworm disease to cats in the same way that they do to dogs. The symptoms in cats tend to be more severe. Unfortunately, cats can go into heart failure quickly, and they can even die suddenly from heartworm disease. And sometimes that can happen with only 1 or 2 worms in the heart. So it's much more severe in cats, unfortunately, and we aren't able to see the clinical signs sometimes as early as we might in dogs.
And is there any options for treating it in cats?
Yes, we want to prevent it in cats. So there's heartworm prevention in cats that you could also give either once a month orally or once a month topically. So same thing in dogs, the key is going to be to prevent it. Now for cats, there's no treatment for heartworm disease. And again, part of that is because it's more difficult to even test cats for heartworm disease. So because they have so few worms in their body, they only have 1 or 2. Oftentimes the tests that we use are not sensitive enough to pick up those 1 or 2 heartworms. And so the treatment for heartworms is also a pretty serious treatment, and oftentimes it's too hard on the cat's body and causes too many side effects. So we don't have an FDA approved drug to treat heartworms in cats, but we have many products that we can give to prevent it. So prevention is going to be the key for cats.
And can a heartworm positive dog be adopted out from us?
Yes, absolutely. So, heartworm positive dogs still live very long, happy, healthy lives. And so we will test all of our dogs for heartworm disease, and we still put them up for adoption because we want them to be able to find families who are going to be able to give them wonderful, wonderful homes. And we are grateful to our partners who help us to be able to do this. We're grateful to VCA, Veterinary Centers of America, who helps us to treat some of our heartworm patients. We even do some heartworm treatments here on our campus, and we will make sure these dogs go up for adoption after they've gotten their treatment and recovered. And we're even grateful to foundations like Bissell Pet Foundation who help us to fund these heartworm treatments. So with the help of some of our partners in the animal welfare industry and people like you who are willing to open their homes to dogs who are recovering from heartworm disease, they absolutely can find a home and they can go on to live long, healthy, happy lives. My personal dog was heartworm positive. When I adopted her, she was a rescue and she lived outdoors. And so she was exposed to heartworms and she was exposed to mosquitoes and she contracted heartworm disease, but she was treated and she's doing well now. And she's about 12 or 13. Wow. So they can live very long lives.
And where can we find cost-effective prevention or treatment for our pets?
There's lots of places that will provide cost-effective treatment. And our pet wellness clinic here at the Houston SPCA offers heartworm treatment. So if your pet has been diagnosed with heartworm disease and you are looking for ways that you can treat your pet for heartworm disease at an affordable cost, please come see us. You will consult with our staff and our veterinarians, and we can give you a plan for moving your pet forward toward wonderful health. Well, we thank you so much for joining us today at the Pet Pawcast. We appreciate you joining us every week, and we encourage you to come on down to our adoption center every day from 11 a.m. to 6 p.m. To visit all of our pets that are available for adoption. And if you have a pet that needs vaccines or needs microchipping or deworming, please come on down to our pet wellness clinic. We're happy to help you. We want to help you keep your pets happy and keep you guys together for a long time to come. So nice to see you guys, and we'll see you next week on the Pet Pawcast.